आप लाइव हैं।
Good evening, everyone. It is a moment of extreme pleasure to welcome all the participants of Yoga Research Study Circle who are present here today to attend today's research-based program. On behalf of Women Health Research Foundation, I convey my regards to today's guest, Dr. Garima Biswas ji. Dr. Garima Biswas ji is a founder director of Umesh Health and Fitness. She is also a renowned physiotherapist and licensed clinical instructor of WOE IIPRE. She is also a labor and child educator too. She has done course from International Institute of Pelvic Flow Research and Educator. She is also a certified yoga therapist, Pilates instructor, and prenatal and postnatal yoga instructor too. Today is 23rd episode of Talk Series 3rd with Garima ji. I request Dr. Garima ji to enhance our knowledge on the topic cervical cancer myths and its solution. A very warm welcome to you, Garima ji.
Thank you so much, Gitanjali ji, for introducing me in such a way. And I would like to thank the Neha ma'am, the president of WHRF Trust, and Yoguru Mohan sir for inviting me here and for giving me this opportunity so that I can lighten this less explored field. So I thank to all the team of WHRF for inviting me here so that I can share my knowledge about this and with you all. So can anyone share my PPT, please? So today's topic is the cervical cancer. What is it? Its myths related to the cervical cancer and solutions related to the cervical cancer. So firstly, we have to understand what is the cervical cancer. So cervical cancer is the second most common cancer in a female, especially. So this is the most common among the females, and it is also at the same time less explored, and female has no such knowledge about what is this cervical cancer. So before going into my presentation, firstly, I would like to introduce what is the cervical cancer. So cervical cancer is basically a cancer that starts in the cell of cervix. And what is the cervix? The cervix is basically the part that connects the uterus to the vagina. So it is the lower narrow end part of the uterus, and it basically connects the uterus to the vagina. So cervical cancer, as its name suggests, they develop in the cervix, but it's not developed suddenly. It takes some time. It develops slowly over a period of time. And before this cancer appears in the cervix, the cell of the cervix goes through the changes that is called as the dysplasia, in which some abnormal cells begin to appear in the cervical tissue. And over the time, if this abnormal cells are not detected and not removed from the cervix, this abnormal cell, with over a period of time, it may changes into the cancerous cell, and it starts to grow and spread more rapidly and more deeply into the cervix and also in the surrounding areas of the cervix. Next slide. So for the better understanding of the cervical cancer, firstly, we have to understand the female reproductive system about the anatomy of the cervix. So here you can see this is the female reproductive system. That is the uterus, two ovaries, and the two ovaries connected with the fimbriae and the fallopian tube. And the end part of the uterus, as I earlier told, that end part of the uterus is called as the cervix. So here you can see that the junction between or connecting point between the uterus and the lower part of vagina, that is the cervix, it develops or some kind of abnormal cells in the cervix. These abnormal cells over a period of time convert into the cancerous cell if it's not detected in a proper time. So it will convert into the cancerous cell. So this is the basic anatomy of the female reproductive system. Next slide. So we have to understand the part of cervix. We discussed that cervix is the junction between the uterus and the vagina. It is the lower part of the uterus. And the cervix has the two parts, that is ectocervix and the endocervix. Ectocervix, as its name suggests, that is the outer part of cervix, and the endocervix, its name suggests, that is the inner part of the cervix. So the outer part of the cervix, the ectocervix, that can be seen during the gynecological examination, and it is basically covered with the cells that is called as the squamous cell, that is the thin and the flat cells. So basically, ectocervix is made up of the squamous cell, and the endocervix, which is the inner part of the cervix, it forms a canal that connects the vagina to the uterus. And the endocervix is covered with the glandular cell that makes mucus. So here we saw that ectocervix is the outer part of the cervix, and it is made up of the squamous cell, and the endocervix is made up of the glandular cell. And where the ectocervix and the endocervix meet, the junction of this is called as the transformation zone. And this is the area where the cancerous cell develops. So most cervical cancers begin in the squamous cell in the transformation zone where the ectocervix and the endocervix meet. So this is the area where the abnormal cell grow over the period of time. It converts into the cancerous cell. Next slide. So how many types of cervical cancer we have? So basically the cervical cancer are named after the type of cell where the cancer started. In the first type, that is called as a squamous cell carcinoma. Squamous cell that is basically found in the ectocervix. Earlier we saw this in previous slide that ectocervix is made up of the squamous cell carcinoma. So that's why its cervix are this cervical cancer are basically called as the squamous cell carcinoma because these develop into the cell of the ectocervix. And this is the most common type. Basically, up to the 90% type of cancer is the squamous cell carcinoma, and the adenocarcinoma that develop into the glandular cell of the endocervix, but it is the least common, and it is a rare type of the cervical cancer. And sometimes the cervical cancer have both type of features, that is the squamous cell also or the adenocarcinoma also. Glandular cell is the endocervix, but it is called as the mixed carcinoma, and it is very rare, and it is developed into the other cells of cervix, not in the squamous, not in the adenocarcinoma, but it is the rarer type of the cancer. So most common type of the cancer is the squamous cell carcinoma that develop into the ectocervix, basically in the squamous cell. Develop into other cells of cervix, not in the squamous, not in the adenocarcinoma, but it is the rarer type of the cancer. So most common type of the cancer is the squamous. Very important It is very important to know what is the sign of cervical cancer, because by this we can only know the cervical cancer. And here are some signs like vaginal discharge, that is thick or rough or tint with the blood. And you can see this vaginal discharge during the pelvic examination, during after the menopause, or during your between your menstrual cycle. And you will observe that your menstrual cycle will become more heavier and it lasts longer than your usual period. And also there is some pain and vaginal bleeding during the sexual intercourse. And also there is the vaginal bleeding during a pelvic examination. So this is the early sign of the cervical cancer. And when the disease become advanced, that includes swelling of legs, problem in urination, or having a bowel movement, and the blood in the urine. These last three symptoms you will see in the advanced disease, and upper symptoms are the early sign of the cervical cancer. So this is very common to know, and every woman should understand this signs of cervical cancer. And whenever you feel some changes in your discharge or in some changes in your menstrual cycle, definitely you should consult with a gynecologist or a concerned doctor. So next slide, please. Now, what could be the possible cause of the cervical cancer? So all women above the age of 35 can be a risk of the cervical cancer. So most often in women over the age 30 or 35 years. And at least it is a long-lasting infection with this certain type of HPV virus, that is the human papilloma virus, is the main cause of the cervical cancer. But the cervical cancer is the thing that does not develop suddenly. It will take time, and it will take years, basically 10 years or more, to develop in the cancerous cell. And there will be long interval between whenever a person infected with the HPV virus. So it will take a long time, maybe more than 10 years, to develop the symptoms of the cervical cancer. Next slide, please. So what are the common risk factors to develop the cervical cancer? First is the having HIV. Second, if you are using birth control pill for a longer period of time, or having given birth to 3 or more children, or having the several sexual partners. So this cervical cancer is not only related to that you have a multiple sexual partners. It is also related to if you are not maintaining the proper hygiene, sexual hygiene, or proper hygiene during this bowel movement. So you have to maintain a proper hygiene during your sexual intercourse also. Next slide, please. Now, how we can check for the cervical cancer, or what we can do for the screening of cervical cancer. So our goal is to detect any abnormal changes in the cervix before they become into the cancerous cell. So there are two types of tests that will be called as the PET smear test, that basically detects the abnormal cell in the cervix. And second is the HPV test, that is the human papilloma virus test. The HPV test detects the high risk type of human papilloma virus infection that are most likely to cause cervical cancer. There are many types of HPV infection, more than 100 types of HPV virus. Not each and every virus develop to the cervical cancer. So it is not that you are infected with the HPV virus, so you will certainly develop to the cervical cancer. It is not like that. Okay. So here are two tests. By this, you can check for the cervical cancer. So next slide, please. Now, what are the stages of the cervical cancer? The stage 1. In the stage 1, the abnormal cell develops only in the cervix, and the cells would be very small in size. And in the second stage, these cells or cancerous cells, it develops beyond the cervix and also in the surrounding organs like in the uterus. And in the third stage, it is straight to the lower part of vagina, and also it includes the pelvic wall. And fourth stage is the spread to the bladder, rectum, or other part of the body. But it takes years to develop or years to convert into the first stage, second stage, third stage, and fourth stage. So there will be a more than years of time in this developing or going into the further stages. Next slide, please. Here you can check the different type of the cervical cancer. In the first 1B slide, you can check that cancerous cell is developed only in the cervix, and that is the smaller. That is around less than 4 centimeters. In the second one, you can check that now cancerous cells become larger in the size, and it covers most of the area of the cervix. And in the last diagram, in the 2A diagram, you can check the cervix, that is these cancerous cells now spread to the vagina also. And in the next slide, next photos here, you can check that this cancerous cell covers all the part of the vagina. That is the stage 3. So here are the stages of the cervical cancer. Next slide. So now, what would be the treatment of the cervical cancer? So this depends mainly on in which stage of disease you are, what is your age, and what is your general health condition, what is your medical history, and again, if you want children in the future or not. So treatment is basically depends on these 4 criteria: stage of the disease, age, general health, and depends on if you want children in future or not. Next slide. So treatment basically includes, again, these treatments are depend on the stages of the disease. The overall treatment, it includes the radiation therapy, chemotherapy, surgery where the excision of the abnormal cells is done, and targeted therapy, and also the immunotherapy. These are the treatments of the cervical cancer. I'm not going into the further detail of this the treatment of this cancerous cell. Now, the one question that all female normally ask is, can cervical cancer be prevented? So yes, cervical cancer can be prevented, but it needs some regular follow-up or regular gynecological examination. Whenever you see some changes in your menstrual cycle or menstrual bleeding, kind of discharge in your cycle, definitely you should go for the gynecological examination for this. Now, getting PAP test, getting the HPV vaccine, and limit your sexual partners. Here I would mention also, maintain your sexual hygiene during the sexual intercourse, and stop smoking alcohol. And always the most important thing is the use precautions during the sex that will prevent the sexually transmitted disease, STD. Next slide. Now, here are some common myths that everyone have in their mind. So first thing is, can cervical cancer cannot be prevented? So this is not true. Cervical cancer can be prevented, but it needs regular follow-up, examination, pap smear test, HPV vaccine. By this, we can prevent the cervical cancer. Second common myth is that causes of cervical cancer is not known, that is the unknown. But in reality, this cervical cancer is developed from the HPV virus, that is the human papilloma virus, and also if you are not maintaining the proper hygiene during the sexual intercourse or during the, or you are using this public toilets all the time, so this also develops transmission of the HPV virus. So And third myth is if you have HPV virus, you will develop cervical cancer. This is not true. There are more than 100 variety of the HPV virus, and not all the HPV virus develop the cervical cancer. There are only few HPV virus that can develop to the cervical cancer. And now again, a common myth is that cervical cancer only occur in the less developed countries. It is not true. The cervical cancer, it is the if we check for statistics, then it is mentioned that 3 out of 5 women can develop the cervical cancer. So it is not true that it's developed only in the less developed countries. I need an annual PP test to screen for the cervical cancer. Not annual, this is not true. If you are falling into the risk factor, or if you are on that age criteria, so in that case only you need this test should be done in a year, because sometimes the false result also come if you are going for the this test very frequently. It will develop, sometimes it develop also the false results that will develop into the anxiety and the stress. And now cervical cancer screening test for the all gynecological condition. No, this is not true. The cervical cancer screening is only for the to detect for the cervical cancer, not all for the gynecologist cancer. This is not true. So here are some common myths which we should know that what is right or what is wrong. Okay, next slide. So this is all about the cervical cancer in a brief, where we discussed about the what is the cervical cancer, anatomy of the cervical cancer, and the stages, treatment, screening. So this is all about.
Dr. Garima ji, it was a wonderful session, but we have some questions from the audience that they would like to ask.
Yeah, sure, please.
My question is, what is the age of taking cervical cancer vaccine?
The average age for the cervical cancer taking vaccine is from the 9 years to the 25th year. This is the most safer period where you can take this vaccine. After this vaccine works effectively when you are not sexually active. Whenever you become sexually active, this vaccine doesn't work properly. Give 90% results when you are not sexually active.
Okay. And the next question is, what should be the dose of cervical vaccine and possible side effects?
There are 2 doses of the cervical cancer vaccine. The first dose, which should be done under the age of 15 years, and there should be a gap between the 6 months or in the sometime also the 12 months between the 2 doses. The average gap between the 2 vaccines is the 6 months. And first dose should be complete before the age of 15 years.
Okay. And are there any side effects of these vaccines?
No, there are no much side effects. The general side effects are sometimes we have fever or any kind of just inflammation, not more than that.
Okay. I think all the questions have been answered properly by Garima. So I sincerely thank Dr. Garima ji for sparing her precious time and throwing light on the importance of cervical cancer myths and its solution with us today. It was a wonderful session, Dr. Garima ji.
Thank you so much.